Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I am also an IBCLC. I am maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders, as well as perinatal bereavement. Flu vaccine is recommended to pregnant women every day, yet most women don't understand why it's being recommended or whether it's even safe to take. Let's explore what the flu vaccine is about and why you should consider getting vaccinated. Before we continue, you will notice we use the term flu vaccine for the ease of presenting the material. Flu and influenza are considered the same term, so saying the flu vaccine means the same thing as saying influenza vaccine. The flu is a contagious respiratory illness caused by the influenza virus. The virus can infect the nose, throat, and lungs. It can come on suddenly and unexpectedly. The illness is worse than a bad cold, and it can range from mild to severe. Influenza can even cause death in the worst cases. The virus is spread by tiny droplets that are spread from person to person through coughing, sneezing, and talking. These droplets are inhaled by other people through the nose or mouth, which causes the infection. Influenza can also be picked up by touching contaminated surfaces and then touching your mouth, eyes, or nose. Certain groups of people are at higher risk for contracting the flu and developing complications. These include adults over the age of 65, children under the age of 5, people with compromised immune systems due to illnesses or diseases like asthma or cancer, and pregnant women. Pregnant women are considered immunocompromised. Decreased immune system activity is required in order to keep the mother's body from attacking the foreign body that is the baby. This status puts pregnant mothers at risk for complications of the flu, some of which can be life-threatening. These complications can include pneumonia, preterm labor, and preterm birth. You are more likely to be hospitalized if you contract the flu while you are pregnant, and your risk of dying is also increased. Getting a flu shot reduces this risk by 40%. Additionally, fever caused by the flu early in pregnancy has been associated with fetal birth defects. There are many signs and symptoms of the flu you can look out for. These include headache, fever, chills, fatigue, coughing, muscle aches, sore throat, runny nose, and stuffy nose. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about flu vaccine facts. Flu season is October to March. Vaccines are offered even before flu season begins. There are two types of flu vaccines, a shot and a nasal mist. The shot contains inactivated virus, which means it cannot cause the disease. The nasal spray is a live attenuated vaccine, which means it could cause the disease. The vaccine works by triggering your immune system to make antibodies against the flu virus. It takes about 2 weeks for your body to build up protection against the flu. Once that happens, if you are exposed, your body can fight off the flu virus. Flu viruses change from year to year, so everyone needs to get vaccinated yearly to be fully protected. Pregnant women should not get the nasal vaccine and instead should receive the flu shot. This can be given to a pregnant woman anytime during their pregnancy. Both the Centers for Disease Control and the American College of Obstetricians and Gynecologists recommend that all pregnant women, regardless of trimester, be vaccinated during flu season. Flu vaccines are safe, and studies have shown that they are not known to cause birth defects or issues with pregnancy. The earlier you get vaccinated, the better off you are. Additionally, when the flu vaccine is given to women during pregnancy, the antibodies they make cross the placenta. These antibodies protect the baby after birth, which is important because babies under age 6 months are at high risk of developing severe illness if they contract influenza. The flu vaccine is also safe for breastfeeding women, and breastfeeding mothers can also pass antibodies to their babies through the breast milk. Women who have pre-existing medical conditions should check with their healthcare providers prior to receiving the flu vaccine. Side effects of getting a flu vaccine are very mild. They usually only last 1 to 2 days and are far safer than contracting the flu itself. Side effects include soreness, redness, and/or swelling at the injection site, headache, fever, nausea, fainting, fatigue, and muscle aches. Flu shots will rarely cause serious, severe allergic reactions. If you have had a severe reaction to any vaccine or you are allergic to eggs, you should consult your healthcare provider prior to getting the flu vaccine. There are many myths related to flu vaccine and pregnancy that I would like to clear up. Number 1, flu vaccines cause miscarriage. A study in 2011 showed an increased risk of miscarriage after receiving the flu vaccine. However, the study was small and had several flaws leading to inaccurate results. Since then, multiple studies have been conducted and have shown no correlation between flu vaccines and miscarriage. Number 2, vaccines cause autism. Numerous studies have been conducted since allegations that vaccines cause autism first surfaced. No evidence has been found to support these allegations. Furthermore, no evidence has been found that thimerosal, a preservative used in vaccines, causes autism even if the mother receives the vaccine. For mothers who prefer, there is a thimerosal-free flu vaccine. Number 3, the flu vaccine causes pregnancy complications and adverse fetal complications. There is no link between the flu vaccine and many complications, including chorioamnitis, gestational hypertension, preeclampsia, premature delivery, small for gestational age or SGA babies, and having birth defects. Finally, getting the flu vaccine will protect you from contracting other viruses. The flu vaccine is designed to protect you from the influenza virus only. It cannot protect against other viruses like coronaviruses, hantavirus, rotavirus, and many more. The flu vaccine will also not protect you from the seasonal cold. The flu vaccine is a safe vaccine that can prevent serious complications for pregnant women. I hope this has explained the benefits and safety of the flu vaccine and given you the information you need to consider vaccination. Please share your comments and let us know what topics you would like to hear more about. If you like this content, remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.